Hello. As we are all being thrust into virtual work, I wanted to compile some tips and tools about patient centered communication through the computer. Telemedicine has been around for a while, and at least during my training years, we often talked about it really reserved for rural communities. Now, however, due to COVID-19, we're all thinking about ways that our services can be offered remotely. And while not all obstetrics and gynecology services can be provided remotely and virtually, many can. I just want to start by getting grounded in terms telehealth and telemedicine. So, for the purposes of my talk, I'm going to be using telemedicine. And the difference, really, as suggested by HRSA, is that telehealth is a broader scope of remote healthcare services. So, provider training, administrative meetings, medical education, while telemedicine is really reserved for direct clinical services. So, again, for the purposes of these slides, I'll be using the term telemedicine. But for example, the American Telemedicine Association really uses them interchangeably. So um, if you find yourself using the term telehealth, I think that's fine. Telemedicine has been used in obstetrics and gynecology in a variety of ways, from prenatal care to monitoring pregnant women with chronic medical illness. In a piece on practice management, ACOG telehealth task force leaders explored how the technology might be applied in routine as well as specialized OBGYN care. And it makes sense right now to just describe the difference between synchronous and asynchronous visits. And I'm not going to go too much into this, as that's not the scope of this talk, but I think if these are terms that you're starting to see, it's worth talking about. So when you're the care that you're most prepping for right now are these synchronous visits, where you're doing direct to patient real-time care. And asynchronous remote care are things that you might have already been doing. And that's when a patient sends you a picture or a colleague sends you a picture and you look at it and you manage, say, wounds or something that they send to you. The American Telemedicine Association defines synchronous telemedicine as interactive video connections that transmit information in both directions during the same time period. So that's really what we're talking about today. So that's kind of the broad, high level view of what telemedicine is. But how do patients feel about telemedicine? Because bringing patients along with confidence and comfort is vital. And patients generally feel good about telemedicine. This is from a study done out of a VA where the participants were from a diabetes clinic. And some concerns they shared included that there may have been more errors in their care because they don't understand how a physical exam could happen using telemedicine. They felt like the providers paid less attention to them. They felt less able to speak up and ask questions. And if they didn't have a prior relationship with the doctor, they struggled to establish a relationship. So they felt generally less involved, had difficulty finding opportunities to speak, and also felt rushed. So, how can we take these fears and concerns and adjust the way that we deliver our virtual care? So, some things that systems can do. So when we think about the concern around errors in their care, some considerations, and we have an opportunity to develop patient education materials where we're providing patients encouragement to speak up, express concerns. I often think of the push, the speak up push that we did. And so where medical staff reminded patients of this initiative, as well as having things in the bathroom. And so there, how can we get that kind of information to patients virtually, so we can continue to promote it as a value in their medical care? Another challenge is perceptions that providers paid less attention to them. Again, developing some patient education materials that legitimize patients' use of active communication strategies, letting the doctor know if you can't hear her, if the audio is down, not being afraid to interrupt if something is not working about the connection. And then there are some things that the providers can do. And these are things that I'll go into a little bit more towards the end of the slides, but um, attending to specific telehealth behaviors, making eye contact, not looking at the person in the screen, but looking at your camera directly. Maybe minimizing that self view once the session has been going on, because you want to confirm that what the patient is seeing and hearing works, but sometimes when you keep that self view on, you tend to look at yourself. And being mindful of actions and avoid distracting behaviors. Like if you're taking a call, for example, I was talking to somebody that was sitting in a rocking chair, and while it was quite soothing to her, she was rocking back and forth, and it was a little distracting. When to address the challenge of barriers, speaking up and asking questions, again, some suggestions about the development of patient education materials, um, creating materials that encourage and maybe even teach patients how to make lists, so they can have a list next to them about things that they want to prioritize and discuss during the web session. You can also address some common myths about virtual visits, um, and we can also offer some provider education about agenda setting, avoiding jargon, and some of those reminders, maybe some of those things that haven't been spoken to directly since intern year, perhaps, or even med school. And remember, patients also said that if they didn't have a prior relationship, that they struggled to develop that virtually. And so this is what I want the thrust of the rest of the slides to be, is about developing website manner. Now, I wish I had come up with that, but I didn't. But really, it's using technology to engage patients. And so to take something that is commonly thought of as a hindrance, but really maximize it and utilize some of the opportunities that web sessions could provide. So thinking about a website manner. So these are some elements of patient-centered communication that the literature has identified as ideal aspects of successful patient-provider visits, starting with establishing rapport, going through these steps to closure. And so patient-centered communication is something that has been discussed a lot in literature. When I was the resident, the behavioral health director for family medicine, this was a lot of the work that I did with the family medicine residents. And while virtual visits changes these and alters these interactions, it makes them more important, not less important. And this idea of digital empathy becomes important as well. There's been some research on digital empathy, and basically the foundation of that is that the computer at its worst can dull our empathy and can promote maybe more harsher or less kind interactions online. I mean, just think about the last Twitter thread you followed. So the importance of considering and attuning and paying specific attention to digital empathy as you're delivering care is really important. So when we're thinking about good website manner, we really start with this idea of making an introduction. And unless it's taking place between a physician and a patient who've met before, it's really important to open with a formal introduction. And that should describe a description of the kind of work that you do, your name, and potentially even an explanation as to why you're doing a virtual visit, even if you feel like this should be clear. And finally, right up front, you should be talking to patients about what to do and what next steps would be if the connection's lost. And that's kind of like when you call your bank or your credit card and they say, is this a callback number should the connection get disrupted? You really want to assume that you might have some difficulty with the connection, just so you have all the information that you need to provide continuity for the session. You also want to ensure the setting is just right. So you want to ensure that you have a strong internet connection such that you can minimize the risk of delays or other problems. You want to attend to lighting. Sometimes if I'm on a Mac laptop, I'll open up the FaceTime app to just get a sense of what my background and my lighting looks like before I turn on Zoom or something or start the session. And again, with this point about looking directly into the camera and not at the monitor or yourself. Some other things to consider about the setting is think about wearing headphones, earbuds, or even a headset. A lot, if you are just using the audio from your computer or laptop, you can get a lot of outside noise and distraction. And if you're using potentially a larger headset, you might want to make a note of why you're wearing them and just, you can mention, I'm in a private setting, but I want to minimize outside noise so that people don't, so that you're the patients that you're seeing don't think that you're not in a private location. And additionally, with privacy, you want to attend to your patient's privacy. And so if it looks like your patients aren't in a private place, you might want to offer to wait until they can get into a private location, suggest they find a private location, or encourage them to find an alternate time, especially if they're adolescents. I know I was talking to a patient recently, and when we connected on the video, I could tell that she was in the car and she wasn't driving and somebody else was there. And so I informed her that that wasn't an appropriate setting for the phone call of the nature we had to have. And, we scheduled a different time. And some cues that you can kind of attend to is if the patient keeps looking off to the side or looks beyond the camera, and you can kind of ask them, is there somebody else in the room? Are you really private? And you can attend to that. Another piece here is to acknowledge limitations. While patients in general understand and can transition to virtual sessions, some do have concerns, and you can acknowledge those. And you can acknowledge your own limitations about your setting. So for example, if you are in a confidential location, but you do have an animal that sneaks in the room sometimes, or there is construction happening across the street, I'm projecting a little bit because that's what's happening to me. You can acknowledge to the person you're speaking to, you may hear a dog in the background, or you may hear construction. I've got my earbuds in and I can hear you. Please let me know if it becomes distracting. And again, you can set the tone and speak to things so that then they feel empowered to say, I am having a hard time hearing you. Could you move to another room, or could we pause? A good piece of website manner is also to increase enthusiasm. So while it can feel more awkward to communicate through the computer than in person, it is still possible. If anybody's ever watched TV or seen a TV show being filmed, everything is done over the top, because when it comes through the camera, everything feels a little bit more muted. So pay attention to your body language and demeanor. Don't be afraid to be a little bit more enthusiastic or warm over telemedicine. So having a smile, giving a very warm hello, it might feel a little awkward, which is why you can minimize your own picture, but it's definitely appreciated. Behaviors and expressions meant to put patients at ease and create a greater level of intimacy that telemedicine may otherwise undermine. simply due to the fact that it's not an in-person meeting. So we're trying to really address that. Allowing the patient to speak. So this might seem simple, but it's really has been shown that in visits, for a variety of reasons, patients sometimes feel cut off and they feel that their physicians interject or cut them off. And to really attend to that over when you're doing virtual sessions is important. It's already difficult if you've got a delay in connection or if your patient's connection fragments at all. So, really taking time in between what you say and what the patient says to make sure that you don't talk over each other. And if you've got something long that you need to describe or ask, you can think about delivering it in shorter bursts that gives an opportunity for the patient to interject and minimizes opportunities for talking over. Another really important element of website manner is to look presentable. An easy way might be to just put your white coat on, even if you're taking the call from home or from a remote location. Something that just polishes you a little bit, I think it goes a long way. It connotes and sends a message that the medical care isn't slipping just because it's being done remotely. So any efforts to towards your presentation is definitely valued. So and not to be minimized. So these were some tips that were compiled from these references. I hope that they've been helpful. And I hope they just provide, if nothing else, some reminders of things you already do over the course of your care and where you can welcome this new slash old world that we're in and go forth and continue to do the great care. Please reach out to me, cnorcott at bsd. .uchicago.edu if you need any other tips or want to add anything. I'd love to hear from you. Take care, everyone.